Well, hello there, and welcome to the third and final part of EP CVC02, Anatomy and Physiology Part 1. This session will be focused on joints and joint movements, and we'll have some fun with some movement analysis when we jam it. So the session will run for around 20 minutes, so make sure you're in a quiet spot with no interruption, and prepare to move a little in this one. We're going to begin the session with a quick recap on the function our bones, skeletal muscle and joints play when we move. So together, the bones, the skeletal muscles and the joints create our levers. The bones are the lever, the skeletal muscle is the force, the joint is the axis, and the weight we train with is the resistance. So the distance between the axis or joint and the force or muscle is called the force arm. The distance between the axis and the resistance is called the resistance arm. If we move the axis closer to the force, so if we move this closer to the force, to here, that's a funny triangle, we need more force to do the exercise. So the exercise therefore becomes harder. Let's delete that. Take closing a door, for example. If we hold the handle and have the longest force arm from the door hinges, the door is easy to close. If we try to push the door closer and nearer to the hinges, it becomes much harder. An exercise example would be reaching your arms overhead while performing a back extension. In this exercise, rather than shortening the force arm, we make the resistance arm longer, which by relativity will make the force arm shorter. On the flip side, if we move the axis closer to the resistance arm, let's see if I can make a better triangle, not really, we make the exercise easier. Okay, so we make that resistance arm shorter. So, for example, dropping to your knees in a push-up is an example of reducing the resistance arm and making the exercise easier. All right, now that we've cleared that up, let's get into our joint movements. We'll begin with movements that take place in the sagittal plane. Remember, that's the plane that divides the body into left and right, and the actions can be seen from the side. Feel free to try these actions out as we go through them. It always helps to understand them. We'll start with flexion and extension. So flexion and extension happen in the sagittal plane. Flexion can be defined as the angle between two bones becoming smaller. And extension is when the angle between two bones becomes larger or is increased. So these two movements occur at most of our synovial joints. An example of flexion of the vertebrae, which we call trunk flexion, is at the ab curl. And an example of vertebral extension or trunk extension is a back extension. The ankle, however, has their own special actions, including plantar flexion, when the toes are planted into the ground, and dorsiflexion, when they are raised, and you can liken it to making a dorsal fin with your foot. So let's think about everyday movement of walking. When we lift our leg to take a step, we flex the hip and the knee and dorsiflex the ankle. When we plant the foot, we then extend the hip and the knee, and as we travel forward through the foot, we plantar flex the foot. So we plant the toes down, ready for takeoff again. In the upper body, as this is happening with the lower body, we swing our arms. And to do this, we flex the shoulder when moving forwards, and then extend the shoulder when we swing the arms back. Okay. Moving on to the coronal or the frontal plane. Remember, this plane divides the body into front and back and can be seen from the front. So we have abduction and adduction. Think about making a snow or sand angel. So abduction is when we move a limb away from the midline. So you could say your arms or your legs are being abducted by aliens. Adduction is the opposite action, when we add the arms or the legs back to the midline. We also have lateral flexion, and examples of this is when we tilt our head on the side, and this is lateral flexion of the neck. Lateral flexion of the trunk occurs mainly at the thoracic vertebrae when we tilt over to the side, and of course we can do this to both sides, but you may find that one side is tighter than the other. We use elevation and depression to describe the position of the scapula in the main. When they're elevated, they rise up to your ears, much like a shrug, and when we depress the scapula, they're pushed down further away from the ears. So our scapula also rotates in the coronal plane. When we abduct the shoulders to take the arms up away from the midline, our scapula will also upwardly rotate, with the inferior angle of the scapula moving away and rotating upwards and laterally from the midline. Exercise examples of this are the lateral raise, as you can see here in the top image, and of course our wonderful compound exercise, the shoulder press. When we adduct, so bringing our arms closer to the midline again, our shoulders, and bring the arms back to the midline, our scapula move in a downward rotation with the inferior angle coming closer to the midline. So this action occurs in exercises such as the wide grip lat pull down and the chin-ups, and we'll have a look at that a little bit later. Okay, are you still with me? We've got one more plane of movement to go through, and then we'll analyze some of our favorite resistance exercises. Okay, so remember the horizontal or transverse plane divides the body into upper and lower and can be seen from the top. When we use the horizontal flexion and extension, we first need to move out of anatomical position and abduct our shoulders or hips so that our arms or our legs are in line with the horizon. Then the same rules apply as they do for flexion and extension. So in the horizontal flexion, the angle is reduced between two bones, but we start the action from out wide. This action is performed at the shoulder in our push-ups and all the variations of the chest press. Horizontal extension is when the angle is increased, and examples of this action at the shoulder include all of our wide grip row exercises. We also have rotation in this plane, and this occurs at the cervical and thoracic vertebrae when we shake our head or we perform trunk twists. When we add medial and lateral to this, we can also indicate which way we are rotating with our shoulders and our hips. So let's have a look at hip rotation. When we medially rotate, we rotate towards the midline. If we medially rotate at the hips, we'll see that our feet start to point inwards and become pigeon-toed. When the hips laterally rotate, that is, they rotate away from the midline, our toes point out like a ballet dancer. We also have supination and pronation in this plane, and this can be related to many positions of the body and in many ways. So remember we referred to this when we looked at the radio-ulnar joint. When referring to this joint, we can liken supination to holding a bowl of soup with our palm facing up, and pronation is the opposite with palms facing down. We can also use this when referring to the whole body. When we lie on our back, so lie on our spine, we are in a supine position, and lying on our front, we are in a prone position. When we walk, we also pronate and supinate at the feet. As we plant the foot, we go into foot pronation and the foot arch flattens. And when we take off from the ground, the foot supinates, making the arch increase. Okay, so let's move to the scapula and look at retraction and protraction. When we retract the scapula, they move closer to the midline and we pull our shoulders back. When the scapula protract, they move away from the midline and we get a rounding of the upper back. I hope you're trying all of these out as we go through them. It really does help to establish an understanding of them. Okay, our final movement is a hybrid action of circumduction, and it's a combination of movements in multiple planes, including extension, abduction, flexion, and adduction. Okay, so let's think back to the start of the session. To make an exercise harder, would you make the resistance arm longer? Is that A, true, or B, false? So to make an exercise harder, you would make the resistance arm longer. Is that A, true, or B, false? If you answered A, you're correct. You would indeed make the exercise harder. Good work! And we're on the final leg. Now that we know how our joints move, let's consider how we exercise. So we perform all of the actions we have covered on a daily basis. And we are free from injury, we perform them well. If we want to maintain our health and move freely, we need to rehearse these actions, and this is why functional training is the best. So we always perform large compound exercises and work towards using free weights, standing up, and training movement patterns, so we can incorporate everyday movements. So let's have a look at a few of these as we use your newfound knowledge together with some movement analysis, and let's jam it. In this session, we'll focus on joints and action, but I will mention the prime movers for each action as a bit of an intro for you. So we'll establish each joint, each action at those joints, and then which muscles are the prime movers of each of those actions. So let's start with the squat, a great functional exercise for the lower body. First, we'll establish the concentric phase of the exercise, which is when we move upwards and go from a sitting position to standing. The image shows the start of the concentric phase. So when we move from this position to the standing, we will have the movement at the hip, the ankle, and the knee. Not necessarily in that order. So hip, knee, and ankle. The actions at all of the joints occur in the sagittal plane, and the actions on this plane are flexion, extension, plantar flexion, and dorsiflexion. So much like when we stand up in the concentric phase of a squat, is just like we stand up. So we look at the hip, and when we stand up, we extend the hip. We also extend the knee, so we have hip extension, knee extension, and at the ankle, we slightly plant the toes down, and therefore we have plantar flexion of the ankle. Let's go back. So we've established that we've got hip extension, and our hip extensors are gluteus maximus and the hamstrings. Our knee extensors are the quadriceps, and our ankle plantar flexors are the muscles in our calves. So to recap, in the concentric phase of a squat, we extend the hip and the knee and plantar flex the ankles. All right, so let's have a look at the push-up, which is performed in the horizontal plane. Let's identify the concentric phase first. The clue is in the name. Yep, you guessed it. The concentric phase is when we push away from the floor. Now we've established that, let's have a look at the joints in action. So we have the shoulder, the elbow, and also the scapula. So let's start with the action of the shoulder. So this is the starting point here on the right, and we want to get to this point on the left. Remember, this is the action in the horizontal plane, and we have abducted the shoulders from anatomical position in order to prepare for the exercise. We then reduce the angle between the humerus and the bones in the torso, so that when we push up, we perform horizontal flexion. To analyze the action of the elbow, we must remember to always take the movements from anatomical position. If we take out the shoulder action, we can then work out that the action of the elbow, which is a hinge joint and only has two actions, flexion and extension, and in the push-up, the angle between the humerus and the ulna is increased, and we can therefore say that the elbow extends in the concentric phase of the push-up. Okay, so this leaves the scapula. Have a look at the image, and we can see that at the start of the concentric phase, the scapula are retracted, so they are closer to the midline. When we push up, they are protracted, so they move away from the midline. So to recap, we have horizontal flexion of the shoulder, and the prime mover or the agonist muscle of the action is pectoralis major. We have elbow extension, and this agonist muscle is triceps brachii, and scapular protraction, and this is performed by pectoralis minor and serratus anterior. You'll learn more about these muscles in future sessions, so don't panic. Our final exercise is the lat pull down, and we have two variations of this exercise. Again, as is with the push-up, the clue for the concentric phase is in the name, and we pull down on the bar. We can perform the lat pull down in two different planes. To make it easier, we can perform it in the sagittal plane as shown in this image here. You can see that we have a narrow supinated or underhand grip. So let's focus on two joints in action here, and we've got the shoulder and the elbow. When we perform the lat pull down in the sagittal plane, remember we have options of flexion and extension. In the concentric phase, we therefore extend the shoulder and flex the elbow. The agonist muscle in shoulder extension is latissimus dorsi, and the agonist muscle in elbow flexion is biceps brachii. We can make the lat pull down harder by performing it in the coronal or frontal plane, and we do this by changing to a wide grip, pronated grip. When we do this, we change the joint movement, and also we add a third joint. The joints in action in the exercise are now the shoulders and elbows, but also the scapula. In the wide grip lat pull down, the shoulders adduct to bring the arms closer to the midline, and the scapula downwardly rotate. The elbows will still flex. The agonist muscles remain the same, but there is more emphasis placed on latissimus dorsi, and the mid and lower traps are the agonists in the scapular downward rotation. Okay, are you still with me? Good. Take a breath and let's see if you can answer the final your turn in this session correctly. Can you tell me, what is the shoulder action in a shoulder press? Is it A, flexion, B, abduction, or C, extension? Here's a hint. The action is performed in the coronal or frontal plane. And the answer is B. Did you get it? Yes, so it's abduction. Good work. So there you have it. In the past 3 sessions, we've covered body systems and looked in depth at the skeletal system, the muscular system, the nervous system, joints and joint movement, and we've jammed it. So, where to from here? Now it's time for you to start learning the muscles of the upper and lower body, get an understanding of how we use our energy and the energy systems, and you should also be confident enough to start your Falcon Challenge. If you haven't done so already, get going on your Pee-wee Challenge. If you have any questions on anything we've covered in the 3 sessions, please contact your coaches who will be very happy to assist you. I hope you've enjoyed the sessions, and I will see you soon.